Hello, I'm Steve Schumann, Medical Director for Occupational Health for Doctors on Duty. We're a 9-clinic group in the California Central Coast and the Monterey Bay area. We provide occupational health and urgent care services to a variety of clients in this location. We've been working with RateFast for the past 4 years, with their supporting our providers by generating PR4 reports for workers' compensation, and it's been a great relationship. We generate a significant number of PR4 reports, and RateFast does the really tough work of generating those reports that are based on the clinical information that we provide. That really saves our providers a lot of time and assures accuracy of report generation. Producing the PR4 report requires very specific knowledge. That knowledge is not common to all of our providers. We've got a number that are relatively new in workers' compensation. And using RateFast allows virtually any of our providers in the clinic to submit an appropriate report to the work comp carrier. In the course of producing these reports, RateFast organizes all the clinical information based upon the patient history, physical exam, diagnostic tests. We provide that. Then RateFast generates the report really in a timely fashion. We often get these back in just a few days, which is particularly helpful because most of the time we've sent a work status report to the employer and to the insurance carrier indicating that a PR4 report was forthcoming. It's really helpful that the report actually can be sent shortly thereafter. Report quality is great, and then to facilitate that process even more, RateFast has worked with our IT staff to develop a format for our EMR that allows us to easily assemble the required information, which is a huge help to our providers. Particularly helpful is that RateFast deals with cases that have multi-body part impairment and disability, which otherwise is really very difficult for the clinic provider who's trying to generate that report by himself or herself. RateFast covers all the body systems in the AMA guides, deals with the pesky issues of apportionment and Almaraz-Guzman, which can be particularly challenging to primary providers. RateFast is scalable to large groups, supports virtually any number of providers, large or small, and particularly valuable is the willingness of RateFast to answer questions that occasionally come from carriers on the report submitted. We're able to turn to RateFast to help generate a response that is useful to the carriers. This really continues to be a great relationship. I recommend RateFast unequivocally to any medical group providing work comp medical services and generating PR4 reports. I signed 5 RateFast reports today that I've done in the last week or so, so it's saving me a lot of time.